My name is Allison Venuto, and I am one of the board members for American Pilgrims on the Camino. I appreciate you giving of your time this morning to join us and share some time together. We have our speaker here with us today, and we have Ildefonso de la Campa Montenegro, who is going to speak with us today. He is going to share some updates, give us some information about what's going on in Spain. And if you have questions, if you would put those in the chat, and then he plans to answer those at the end of our session instead of in the middle of his talk. So if you want to put those in the chat, you are welcome to. I will also be monitoring the chat. So if you have questions that I can answer or anything that he mentions that you have information, you're welcome to share that in the chat as well. We will probably have some more pilgrims joining us, which we have a wonderful group today, but we will probably have some more. So if you could please mute yourself, that way we don't get a lot of background noise because of the number of folks on our Zoom today. We would really appreciate it if y'all could Zoom. And with that, I will ask our speaker to start. Ildefonso, it looks like you're on mute.
The first problem. Thank you very much, Alison, for your advice. Dear friends, dear pilgrims, I'm very glad to stay here with you to present this information about the sanitary situation in the community of Galicia and in Spain in general. I'm Ildefonso de la Campa Montenegro, Managing Director of Xacobeo Society from the government, autonomous government of Galicia. And now I try to compart my presentation. Wait a moment. Okay, you can see the presentation, okay?
Yes.
Yes, okay, fantastic. Then I begin my presentation. Okay, as I see you, dear friends, it's an honor to be able to participate in this webinar with American pilgrims. So it's being able to tell you about the current situation on of the Way of Santiago and the Xacobeo's holy years. My name is Ildefonso de la Campa Montenegro, and I have the responsibility of managing the public entity that is in charge of the Way of Santiago and the planning of the Xacobeo's years. In this presentation, I will try to bring you closer to the current situation of the Way of Santiago in the pandemic context and the actions that we are developing in the government of Galicia so that our pilgrims can carry out their pilgrimage with health, security, and with a renewed path, more sustainable, more accessible, better prepared, and more integrated into the landscape. First of all, I will introduce you some facts about the Camino of Santiago. We have almost 350,000 pilgrims in 2019. At this time, in 2021, we have about 50,000 pilgrims arriving to Santiago in these months. 60% of pilgrims are foreign from more than 180 countries. 1,500 kilometers of Xacobean routes only in Galicia. In 1987, the Camino Santiago was declared first European cultural route. And in 1993, French Way was declared World Heritage for the UNESCO. More than 83,000 kilometers of Santiago ways identified in different countries in Europe, more than 28 countries. 98.6% of pilgrims would recommend the experience of making the way. We have more than 350 associations of Friends of the Way of St. James in the 5 continents. And we have more than 280 routes in 28 European countries. And all of them, we have 1,200 years of histories here in the Way of Santiago. And below is a short promotional video of the Camino de Santiago in 2021.
Silencio. Y quizá hayas andado el camino ya. Cuando mires atrás, si estás atrapado en la sombra, aguarda, aguarda. De las flores más altas, más altas. Si baten contra los muros, las aguas de la grieta nace la duda, más sabia y quizá hayas andado el camino ya. Cuando mires atrás, estás atrapado en las sombras. Aguarda, aguarda. De lo que de las flores más altas, más altas. Si estás atrapado en las sombras, avanza, avanza. Pronto te darás cuenta de todo, de nada. Encantopoidas. Camiña a Galicia.
Well, now we are talking about a way to Galicia in a safe and healthy way. In this slide, I have superimposed the map of the 10 itineraries, here you have, of the Camino de Santiago on the map of the pandemic situation in the municipalities of Galicia. Those municipalities in darker color are where the pandemic index is higher. As you can see, this happens mainly in the urban municipalities with higher population and in the southern area of Galicia and in the surroundings of the big cities, as Vigo in the south, A Coruña in the north, Ferrol too in the north, Ourense in the center of Galicia, and Lugo. This is the actual situation of the pandemia COVID SARS-2 in our autonomous community. We have at this moment passing with active infections some 18,885. Hospitalized today, 266. And in the intensive care unit today, we have 36 people. We have more than 154,000 healed and 2,457 deceased in this pandemic. And we have around 156,000 people contagious in all of the pandemic time. We have 2 new daily cases in the last 24 hours, 1,223 people. We make more than 2.5 million PCRs, and we have 685,000 antigen tests. And we have more than 1 million of other COVID tests. If we talk about the vaccination in Galicia, we have 3.5 million doses received in our community. We administered 3.5 million. We have 1,734,000 of our people with complete doses. We have the 64% of the people in Galicia that have the vaccination complete, 6% with one of these doses, and 30% of our people without doses. They are people, young people from 0 to 26, 27 years. Before traveling to Spain to make a pilgrimage, you must complete the health control form on the website or the app, and from 48 hours before the flight, you can submit the form. Once submitted, you will receive an email with a QR code that will allow you to access the airport of destination. You can print out the code or save it on your mobile phone. If you are traveling, check with your airline before going to the airport, and remember to use the mask. It's mandatory in all public outdoor and indoor space in Spain. If it is not possible to maintain the distance, follow the hygienic measures, maintain a safety distance of 1.5 meters from any other person, and collect your luggage individually. If you are traveling to Spain, if you are preparing a journey to Spain, we inform you that due to the COVID-19 health crisis from July the 1st, 2020, it will be mandatory to present a health control form upon arrival at the airport. You can access the form on this website. Here you have, or download the Spain Travel Health app on your mobile from the same website. You should not travel if you have symptoms compatible with COVID-19, fever, cough, shortness of breath, with onset in the last 14 days, or if you have been diagnosed with COVID-19 in the last 14 days. All passengers arriving in Spain by air or sea, including those arriving in transit to other countries, must complete a health control form before departure and obtain this QR to be presented at boarding and health controls upon arrival to Spain. Here you have the two access to the website if you travel by air or if you travel by sea. This is the web page where you need to make this individual or family group form. And these are exactly the forms that you must refile to obtain the QR pass. This is for family and the other is for singular individual people. These are the third countries that whose residents are not affected by the temporary restrictions or non-essential travel to the European Union across external borders under the terms of this order. As you can see, United States of America are included, and then all the people from America in good health situation can travel to Spain. At the airport of destination in the Spanish airport, you must show the QR code that will be scanned in order to be able to access the terminal and collect your luggage. At the airport and during the flight, maintain a safety distance with the other people of 1.5 meters from others. Wash your hands frequently and cover nose and mouth when coughing or sneezing. When you arrive to the airport, you will see a primary control. If during the primary control, a passenger is suspected of having COVID-19, if he have a temperature above more than 37.5 Celsius degrees, presence of symptoms, or after the analysis of the health control form content, the passenger must be referred to the secondary control, where a more exhaustive assessment will be carried out. The secondary control will include the assessment of the passenger's clinical and epidemiological status, and may include the performance of an active infection diagnostic test, if the competent health authority considers it appropriate. A diagnostic test may be carried out on passengers arriving from a country at risk. Exceptionally, certain passengers may be required to undergo a diagnostic test for active infection for COVID within 48 hours of arrival, the result of which must be communicated to the Foreign Health Service through the channel indicated for this person. If after the health evaluation, the suspicion that the passenger suffers from a pathology that could pose a risk to public health is confirmed, if the passenger is identified as a close contact of a COVID-19 case, or a positive result is obtained after carrying out of approved for SARS-CoV-2, the health alert protocols established in coordination with regional health authorities will be activated. For this purpose, the health authority may request the collaboration of other administrative agencies, civil servants of other institutions. During the trip and during your stay and flight, if you develop symptoms, fever, cough, shortness of breath, or feel unwell during the flight, notify the crew as soon as possible. The use of a face mask is compulsory on public transport and closed space. Airport. Collaborate with the public health screening established at the airport. Upon arrival at the destination, minimize interactions with other persons and the time spent at the airport to reduce the risk of virus transmission. And during your stay, if during your stay in Spain you have symptoms compatible with COVID-19 or other symptoms compatible with COVID-19, such as decreased sense of smell and taste, chills, short throat, diarrhea, or vomiting, you should isolate yourself in your room and call the hotline for your region, and in case of emergency, call 112. Always keep these 6 key points in mind. First, use the mask, distance of security, wash your hands, further contacts in a stable bubble, more ventilation in all the spaces, and stay at home if you have symptoms or you have been diagnosed with COVID-19. If you are in a close contact or a positive case or are waiting for the test results. What to do if I had COVID-19 in your trip? If you have any of the following symptoms, fever or cough, or other symptoms that your doctor should assess, loss of smell, etc., stay at home and call the hotline for your region. In Galicia, you can call to 900-400-116. Here you have all the telephones in the 17 autonomous communities in Galicia. But if you have shortness of breath, a worsening of symptoms, feeling of heaviness or chest pain, then you must call 112. This is an emergency telephone number that you must use wisely. What should, if you do, being in contact with someone diagnosed with COVID-19? If you have been in close contact with someone, if you didn't use protective measures correctly within 48 hours before the onset of his/her COVID-19 symptoms, or within 48 hours before this person positive test to COVID-19, if he is an asymptomatic person, then if you were providing personal care for that person or in contact with his secretion or body fluids, you must go to healthcare, social service, or household settings. If you share the same place at a distance of less than 2 meters and for a total time of more than 15 minutes in 24 hours, go to community settings. The quarantine. What is the quarantine for COVID-19 in Spain? It is a public health measure to control the transmission of the virus that causes COVID-19. It is indicated to avoid contact between people exposed to the virus and other people during the period in which they can develop and transmit the infection. When is this quarantine indicated? When a person has been in close contact with someone diagnosed with COVID-19. What does quarantine involve? The recommended measures to the extent possible are to remain alone in a room of the house for as long as possible, to have a separate bathroom, and to wear a surgical mask whenever you need to leave the room. In this case, cohabitants must also wear a surgical mask, nor should you leave your home during quarantine. How long does the quarantine last? 10 days from the last contact with the confirmed case. The quarantine is 10 days because most people develop symptoms in the first 10 days after being exposed to a COVID-19 case. Monitor for symptoms during the quarantine and also during the next 4 days its completion. Why it's important to keep quarantine? The virus that causes COVID-19 can be transmitted from 2 days before the onset of symptoms. It can also be transmitted by asymptomatic people. Even if a negative result is obtained from a diagnostic test at the beginning of the quarantine period, it is important to continue to its completion. Signs, symptoms of the disease may appear after the result of the diagnostic test and throughout the entire period of quarantine. Recommendations in restaurants, in coffees, and outdoor sittings in Spain. Before going, if you have any COVID-19 symptoms, are in COVID-19 isolation, or are in quarantine because you have been in close contact with someone with COVID-19, stay at home. Call in advance to book a table and find about the establishment safety measures. For example, maximum number of people per group, changes in opening hours, and others. Wash your hands with soap and water before leaving your home. If you have to wait before entering the establishment, stay socially distanced. Try to find spaces that are outdoors and smoke-free. While you are there, stay socially distanced from your companions. Only those who live together can be less than 1.5 meters apart, and from staff too. Don't join tables together. Limit your movements within the venue to only those that are necessary and follow the establishment rules. Wash your hands with soap and water or sanitation help before eating or drinking. Only remove your mask when eating or drinking. Don't smoke. Smoking is damaging to your health and could worsen your prognosis should you catch COVID-19. And consult the rules and specific regulation of the autonomy community where are you staying here in Spain. And now a little short video.
If you are thinking about traveling to Spain, start packing and remember to get your personal QR code in order to board and pass through the health check in the destination airport. We'll explain how to do so in 3 simple steps which you must follow if you've chosen Spain as your destination. Before traveling, fill out your form and get your personal QR code at the website or on the Spain Travel Health app. Remember that if you are coming from an at-risk country area, you must travel with a vaccination certificate, a diagnostic test of COVID-19, a recovery certificate, or the new European Union Digital COVID certificate. You can start when you want, but you can only fill out the health questions and accept the form in the 48 hours before you arrive to Spain. We need your answers to be close to the date you travel in order to protect your health and that of other people. Boarding and at the destination airport, display the QR code from your trip in the authorized reader in the arrivals terminal of the destination airport. Throughout your stay, enjoy our country and follow the preventive recommendations against COVID-19. Please remember, 1. Before your trip, check if you are required to have a vaccination certificate, a diagnostic test of COVID-19, a recovery certificate, or the new European Union Digital COVID certificate to enter Spain. Fill in your form and get your QR. 2. Show the QR code for your trip when boarding and at the destination airport. 3. Enjoy your stay in Spain.
Okay. And this is the safe way, specifically in Galicia community. These are the government of Galicia measures and protocols about COVID. In recent months, various online training courses have been provided to hostel workers on hygienic sanitary matters. Over 600 professionals participating. In addition, professionals are provided of aid to adapt to hygienic sanitary protocols in the shelters, free advice by telephone or mail, and support guides and manuals. We have controlled sanitary situation. The vaccination of the population reached the 64.5% of the citizens and the 99% for people elder from 50 years. Since the beginning of this pandemic, the government of Galicia has been preparing to give health warranties to pilgrims who visit us. In this year to 2021, we are receiving now 54,290 pilgrims in Santiago de Compostela. The pandemic index of the population, to compare, the pandemic index in Spain is 675 people from 100,000 inhabitants. In Galicia is 687. In the United States are 236 today, but in the pilgrims group they are 0.08%. Is very, very, very low. To guarantee the health of pilgrims and Galicia citizens living on the routes of the way, we have developed different protocols, hygienic sanitary measures, and support materials fundamental for the shelters as they are centers of coexistence and proximity with permanent contact among pilgrims. In this slide, you can see the editions of our main action protocols against SARS-CoV-2. The COVID action protocol for pilgrim shelters of the public network of the Xunta de Galicia is the government of our region. actions to reduce contagions on the way, including personal and group measures with their clinical and technical specifications, and actions for pilgrim shelters against SARS-CoV-2 oriented to private hostels. These measures have been developed under the supervision of the Clinical Committee of the Government of Galicia, designed from specialists and medical staff. Protections measures have been taken in both public and private shelters. Reduction of the capacity of the shelters, 30% actually. The vulnerable groups, people who realize all the way as a group of cohabitants, can use the 100% of beds in exclusive bedrooms and only in the private shelters. We make a reduction and separation of beds and bunks, disposable seats and pillows, periodic disinfection of shelters, common space and dining rooms at 50% of capacity, disinfections material for pilgrims, and possibility of reserving a place with 24 hours in the public network of hostels. Galicia, you have to come for sure. If you come to Galicia, you'll be safe for sure. During your holiday in Galicia, you'll be covered by the new COVID-19 travel insurance, free for the pilgrims. Galicia, a safe destination we welcome you to visit. Tourists and pilgrims have extra protections. Galicia is the safe choice for your holidays. This initiative, this insurance, is free for visitors and pilgrims both from Spain and abroad who are not resident in Galicia. To benefit from this insurance, you don't need to apply. You only have to be staying at a regulated establishment in Galicia as a private or public shelter. The insurance is activated automatically. These are the complementary coverage and service for this insurance: medical, surgical, pharmaceutical, and hospitalizations expenses due to COVID-19, medical repatriation and repatriation in the event of death due to COVID-19, and extended stay on account of COVID-19 quarantine. And a little short video.
Yo soñaba cada día poder alcanzar la playa y ahora está tan cerca, casi ya la puedo leer y espero cada vez más próximo al final. Ya puedo sentir tierra seca tras la arena mojada y no me da la gana de pensar que nada es para siempre. Si esta canción se acaba, que acabe el mundo para todos, todos somos nada. Sin las palabras dime qué nos queda. Y vuelven algunas rimas a mi mente cansada, partes de guiones que creía olvidadas, melodías que una vez pensé que iba a perder, se tornan ahora bellas y valientes sinfonías.
Wow. It is good that you know what we have been working on since 2015, so that the pilgrims who visit us continue to be surprised by the way of Santiago. We work for a way more accessible to all people and inclusive with those pilgrims who have some disability. A more sustainable and respectful path with nature and environment. A way with more shelters located in restored historic buildings and safe and healthy way with a recovered landscape. The Xunta de Galicia has acted in these 5 years on 1,500 kilometers along the routes of the way in actions for the conservation and improvement of the path, signaling the way for pilgrims and actions at dangerous crossings. The pandemic has not stopped this work. At the moment, an intervention is being developed in more than 50 kilometers of the winterway in its passage through the Ribeira Sacra with a cost of more than 930,000 euros. Another project we are developing is the creation of rest areas in the hardest sections of the Camino. 53 rest areas have been created or are being intervened. Together with the main Galicia timber companies, we are setting up a project to conceptualize and develop resting areas with natural materials, integrating them into the landscape. We will inaugurate the first pilot area in the first month of this year, including an action to create 30 more resting areas. Another essential project on the Camino is the commitment to energy efficiency and the commitment to renewable energy. We are changing the energy, heating and hot water systems of our shelters for energy efficient systems and from renewable sources, biomass, geothermal and solar energy. The improvement and renovation of our hostel network is another of the main tasks that we have undertaken since 2015. We have acted on the roofs and facades, the water purification systems, and the hostel surroundings. Also, we renewed their furniture, connected the entire network of public hostels via Wi-Fi, improved their accessibility to guarantee the rights of disabled people. In order to achieve the goals of having a shelter on every route of the way with a distance of less than 20-25 kilometers and to increase the number of places in the public network of shelters, we have built or are in the process of building 10 public hostels that will get us this year, 2021, to 80 pilgrim hostels of the Xunta de Galicia. A large part of these hotels are rehabilitations of buildings of historical value, such as the Pazo Palace of the Bishop in Diamondi, which you can see in this photograph. We are starting new construction and rehabilitation projects for 4 more shelters this year, 2021. In the photo, you can see the monastery of Sobrado dos Monses, in which there will be a rehabilitation for the creation of a shelter. We are studying 30 sections of the road to identify a door space in which to carry out interventions to complete the public network of shelters. We have also acted in the information and center of interpretation of the Way of Santiago in order to improve their facilities and the services they provide to pilgrims. In the photo, the interpretation center in the castle of Pambre. We are designing a plan for the aesthetic and landscape improvement of the way's entrance in Galicia and the entrance to Santiago de Compostela. A sign of the commitment of Galicia and its citizens to the Way of Santiago and the pilgrims who visit us is the Galician public investment itself in improvements on the way. Only the actions described above have involved an investment of 66 million euros in 5 years. The only thing we hope to have during this year 2021 and under the protection of our Lord Santiago is pilgrims who can enjoy a safe, open, renewed, inclusive, and environmentally friendly way of Santiago. Now you can see a short video about the project for illuminate the principal historic buildings here in Galicia. Thank you very much for your attention. Bo Camino, buen camino, have a good way to Santiago de Compostela. Thank you very much for your attention.
Thank you so much for that information. We really appreciate it. There are a few questions in the chat. Would you like me to read them to you?
Yeah, well, I am reading now.
Okay.
Let me see. The first one, I am flying to Portugal to start the Camino and taking the ferry into Spain when crossing the border. Can I complete the health control form and get QR code? How? Well, first to arriving to Portugal, you need to have the QR code. When you go into Europe for any of these countries, then you can move in all of the countries in the European Union. Then you only need to have the to show the get QR code only in the first airport of arriving, not in any country that you go in Europe. Okay, I am planning to begin working September the 15th from San Jean. Do I need to complete the form? Yes, sure, to arrive to any country in Europe. I'll be doing Camino Portuguese from Lisbon to Santiago starting 15 August. And news I should be aware of? Well, the pandemic wave now in Spain and in general in Europe is going down. But at this moment we have a worry situation, especially in the young people from 70 to 29 people are the most affected now by the new variant D, because the rest of the people are vaccinated. Then we think that the situation will be better in August and in September without problem. Where is it possible for pilgrims to quarantine? Do hotels allow guests to quarantine there or hospital? No. For pilgrims, we have in Galicia 2 shelters that they are prepared, one for the attention of pilgrims with COVID, and we have here in Santiago, in San Lázaro shelter. Now we have only 1 person that they are in quarantine for positive COVID, and we have another shelter in Lucio and Lugo province that is for people that they are in quarantine for short contact with a person with COVID-19. Then you have all your expenses covered by the insurance, and you have public shelters to attend all the pilgrims. And if the pilgrims is possible to travel, we cover to the repatriation if it's necessary. Another question, can we use our vaccine cards to get into restaurants since we don't have the due COVID certificate? Yes, you can. You can do it in any certificate of vaccination for any country is admitted in all the public shelter and established and restaurants and bars here in Spain. Is there a government website where we can get COVID updates of Spanish regions? Well, not only one web, as any web of any region that you want to visit in Spain, because the measures in each region can be different from one to others. Then it's good to read the specific measures for any region. They are similar one to other, but it's good to read before to visit any community here in Spain. Let me see. Do other regions have the same COVID-19 insurance as the one you mentioned for Galicia? As I know, only Galicia have these measures for pilgrims. There are another communities in Spain that have a specific insurance for travelers, but you need to prove this in the official webs of any region that you want to visit in your travel to Spain. So the pilgrim's insurance pays for the hotel stay if there is need for quarantine? Yes, yes. It covers from a limit of 100 euros today, the distance, the stay in a hotel, and the food that needs the visitor or the pilgrim. The maximum quantity that you can obtain for this insurance is 15,000 euros if you need a repatriation to your country of origin. How exactly would the insurance work if we contracted COVID and had to quarantine in Galicia for 10 days or longer? Would we be sent to a quarantine hotel, for example, or there extend the stay wherever we are? It depends. If the hotel where you stay accept a person with COVID, with positive COVID, you can stay at your hotel. If you are a pilgrim and you are in a shelter, public or private, and you need to stay here in Galicia during your quarantine, then you will be translated by a if you are COVID positive, for a sanitary card, you will be make the translation to the shelter in San Lázaro, and if you need to make a quarantine to be a short contact with a positive person, then we pay the translation to our shelter in Lucio, in Lugo. And there we prepare, there in the shelter, you take all your food that we provide then with a a contract with different restaurants here in Galicia. Is there a website there we can read about the pilgrims insurance? Thank you. Yes, in the web, www.xunta, that is xunta.gal, that is the official web of the government of Galicia. You have information about this insurance. Is there a consideration of providing more public restaurants in areas where there are limited facilities? Yes. Yes, we are programming the new director plan, managing plan for the Way of Santiago 2022 to 2027. And there we are looking for new shelters in different ways. Principally in the winter way, that they have no public shelter at this moment, is the newest recognized way in Galicia. In 2021, we are preparing the construction of 4 shelters there in this way, and in another shelters in other ways in Galicia. Sorry. Also, we are wondering how easy it is to obtain a COVID-19 rapid test in Santiago. Well, we in all the pharmacies, you can obtain a test that in 15 minutes you have the result of this test. And if you have if you have fever or some symptomatology of COVID-19, and you call to 112 telephone number, that is our emergency health service, they make you a PCR, and then it's a definitive result for COVID. See, it's very, very quickly. With a reduced bed capacity in albergues and hotels, are there enough beds for pilgrims? At this moment, yes. We have now only 3 shelters that normally have a large occupation: Cebreiro, 90–95%, Sarria and Samos. And the other, the medium occupation now is 36.9 daily. It's not difficult to have accommodation in our public or private shelters here in Galicia. And I think the last one: can one get PCR tests airports when traveling back to US? In some airports, yes, as in Santiago de Compostela. And in other airports in Spain, they don't make this test. You must consult specifically in any airport if you want to know if they make a test before to traveling back home. I think they are all the questions.
Yes, and I want to say an enormous thank you. This was so much great information for us. I know many people are planning to walk the Camino soon, and you have answered a lot of questions. Thank you, pilgrims, for coming and sharing your lunch, morning, breakfast, I don't know, wherever you are around the world. We thank you for joining us, and we will have another session. We have them planned about once a month for various folks around either here or in Europe that will be speaking with us. So a huge thank you to everybody, and thank you, Ildefonso. You did a wonderful job. Have a great day, and buen camino to everyone.
Allison, Miriam Gale from Jacksonville, thank you for putting these programs together for us. They are amazing. I really appreciate you, Allison, and have a blessed day all.
Thank you, Miriam. That's very sweet of you.
Okay, thank you very much to all of you, and thank you especially for your passion with my English and with my difficulties to explain some of these questions. Thank you very much to all of you.
Your English was fantastic. Thank you all. Have a great day, guys.